Hello everybody, welcome. This is the Animal Health Stop. My name's Helen Gibney and this is Jason Barley. We're both vets and we work within the Disease Surveillance and Investigation branch of the Veterinary Sciences Division of AFBI. And today we're going to talk about some areas of animal health that are particularly relevant to you as dairy farmers. First of all, I'm going to introduce the AFBI Cattle Health Scheme and then focus a little bit more on Johne's disease, and then Jason's going to talk about calf health and bovine abortion. So the AFBI Cattle Health Scheme, we deliver a cattle health scheme and it's celebrating its 10th anniversary this year. It's a scheme that delivers programmes where you can monitor, control and ultimately eradicate a number of diseases. It's a voluntary scheme. It works very much as a partnership between ourselves in the lab and yourselves as herd owners and your veterinary surgeon in practice. And it's delivered by checks, and who are the licensing body who regulate cattle health schemes, and they produce a set of standards to which the scheme must adhere. It addresses 5 of the most important endemic diseases of cattle, and they're prevalent in both beef and dairy herds in the UK and Ireland. The 5 diseases there are BVD and Johne's, and I'll mention both of those again. And then the other 3 diseases are IBR, which is a respiratory virus but also causes milk drop, fertility problems and abortion. Leptospirosis, which is a bacterial disease, also causing a milk drop, fertility problems, abortion and also the birth of weak calves. And then neosporosis, which again is an abortion agent, this time a protozoan parasite. There are 2 equally important components of the cattle health scheme. There's the testing, the obvious testing regime, which is usually an annual herd test, and then of equal importance is biosecurity. The emphasis on good biosecurity is a key benefit of being in the cattle health scheme, because this will benefit your herds not just for these 5 endemic diseases that we're dealing with in the scheme, but also a range of other diseases, and against the introduction of those diseases into your herd and the spread of disease within your herd. And there are a number of biosecurity protocols involved in the scheme, such as the requirement for double fencing, which is a 3-metre double fence with any neighbouring stock, or a mandatory vaccination programme in the case of BVD or IBR if you don't have that double fencing in place. There are also rules regarding the isolation and testing of animals that come into your herd, and that's both newly introduced animals and animals returning from shows and sales, because they're at risk of having met diseases whilst away from your herd and bringing it back into your herd. And then there are other biosecurity rules and guidelines about things such as slurry management, colostrum management, and the sharing of facilities, farm and veterinary equipment and such. Just a quick note about BVD. It's been very much on the agenda for the last few years, and you'll know a lot about it. You'll know that it causes a complex of diseases, including abortion, and then the development of these persistently infected calves, and ultimately the fatal mucosal disease. And just to note that members of the cattle health scheme have been using the compulsory testing for the eradication scheme as a means to monitor BVD within their herd, and ultimately to gain or maintain accredited free status if they use those testing results in conjunction with biosecurity rules. So I'm going to focus a little bit more now on Johne's disease. That's because it has significant challenges, more so really for control than the other diseases. And this is for a number of reasons. Firstly, just the nature of the disease. The disease is caused by a mycobacterium, which is commonly known as MAP. It causes a chronic wasting condition of cattle. It's shed in the faeces, and it's also in colostrum milk, and it can cross the placenta of infected animals into the unborn calf. Animals tend to get Johne's early in the first 6 months of life, but it's only when they're in adulthood do they actually develop the signs of this chronic wasting and the weight loss and diarrhea. So we have this lag phase between animals becoming infected and them developing the clinical signs of the disease. So that's one challenge that we face with Johne's disease. The other one is that the organism MAP is a real survivor in the environment. It can survive for long periods of time outside of the host, and we're talking not days or weeks but months in the environment, and it can remain infective. And then the third challenge that we face is the tests that we have for yonis. We have a number of tests. We have an antibody test that we can use on blood samples and milk samples. And we also have direct tests that we can do on the faeces to look for the organism. But these tests only really show positive in the later stages of disease, just before clinical signs become apparent or when the animal is clinically affected by the disease. And that means that a one snapshot test of your herd cannot identify all infected animals at one time point. That means that if you're testing particular set of animals, like if you want to purchase a young bull or if you want to sell a group of heifers, then an individual test result for yonis is of little value. They could be infected at that stage, but not yet testing positive with the tests that we have. Having said that, the tests are useful, and they're useful if you look at it over a long time frame and you test your herds successively over years, and the results are interpreted on a herd level basis. For yonis, there are two schemes. There's a risk level certification scheme, and we do have some dairy herds in the cattle health scheme and in that scheme, but it's mainly pedigree beef breeders who would be participating in that scheme to get a low risk level, because that increases the value of their animals for sale, and also the welfare and the health of their herd. But I just wanted to discuss a little bit more about the dairy risk level reduction programme, because this is specific to dairy herds, and this involves reducing herd prevalence of yonis over time, but there's not quite such the strict requirements and rules for the removal of animals, and it's more looked at, and the results are looked at and risk assessed. So animals can be tested either using blood or milk for antibodies, and they can be categorised as high, medium or low risk on the basis of results, and then a decision made on where to go with those animals. The early removal of high risk animals is advised, ideally with any calf that they've reared since they became positive, because of what we know about the disease, that they can pass it to their unborn calf, and also in colostrum and via fecal oral route at calving time. And this can be carried out in conjunction with some biosecurity techniques, particularly calf hygiene, to try and reduce exposure to yonis. The other thing to think about is the introduction of yonis into your herd, the between herd transmission, and it's a good idea to buy low risk or buy smart. Try and source animals that are from herds that are actively engaging in a yonis disease programme, ideally the accreditation programme, and have a lower risk of yonis assigned to them. So that's basically yonis. Just to finish, at AFB there's 5 of us involved in administering the cattle health scheme, and part of the benefit of being in the health scheme is that we're always at the end of the phone if you need any advice about biosecurity or testing or the interpretation of results, both to yourselves and also to your veterinary surgeons. And herds that ultimately progress in the cattle health scheme and gain a low risk level certification for yonis or accredited free status benefit in terms of their health and the productivity and the welfare of their herds.
So what I want to do is just run through some of the main causes of loss in young calves or calves up to a few months of age, and then talk a little bit about bovine abortion. And I'm talking really there about frank abortion rather than just poor fertility. You've heard a lot already from Stephen Morrison about colostrum and how to feed colostrum, how to monitor colostrum, how to have a colostrum management plan. But what I want to emphasise again is the importance of colostrum as part of the overall management of very young calves. And if you look here at the diagram just on this side here, and you look at the big segments here, the first, second, third, fourth segments, the biggest chunk of that pie, all those conditions, that's enteritis or scours, septicemia and toxemia, which is blood poisoning, pneumonia and navel ill, all those conditions which are the most common conditions, the most common causes of death in young calves, are really preventable or largely preventable by the adequate transfer of colostrum from the dam, the cow, to the calf. And we would see, if you look in your brochures, there's another pie chart that shows that when we look at the calves which are submitted to the post-mortem rooms in Stormont and in Omagh, nearly 40% of them are deficient in colostrum. And it's perhaps too easy and simple to say that that deficiency is exactly why they're there, but it is a very large part of it. So there is truth in the rumour, as it were, that colostrum is absolutely vital to the protection of the young calves against scours, blood poisoning, pneumonias and naval ills or joint ills. There is another aspect to this as well, and that is the fact that we are in tune nowadays increasingly with vaccinating our cows. We use vaccines against E. coli and rotavirus and coronavirus to prevent scour in the calf. We use pneumonia vaccines sometimes in cows to prevent pneumonia in the calf. We may use salmonella vaccines sometimes in cows to prevent salmonellosis in the calf. But that transfer of immunity from the cow that has been vaccinated into the calf for those vital first few days of life only works if there is adequate transfer of colostrum, because it is that transfer of colostrum that actually transfers the immunity. So if you are using vaccines and you're vaccinating cows to try and prevent disease in very young calves, don't forget that that will not work at all. You'll get no benefit from that vaccine use unless you have colostrum transfer. There are all sorts of other aspects, of course, of young calf management, which I'm not going to dwell on in any great depth, but just remember that there are important features of calf rearing accommodation, and it is instructive sometimes, and sometimes I do it, that when farmers will bring their calf into the PM room, there will be 3 or 4 calves in the anteroom of the PM room, all about the same age. Many of those calves that come in that we see are very, very wet, they're very, very dirty. It's quite clear that the accommodation that they're in is not really coming up to scratch on the dry, well-bedded supply of water, well ventilated, right-sized, everything like that. And very often I think what does happen here is that may not apply to the accommodation as a whole, but there are log jams or bottlenecks in a lot of accommodation. And one of the areas where we can have problems if we are overusing calving pens, for example, you get this sort of bottleneck rather like a traffic jam on the motorway. So just to reiterate, don't forget the importance of colostrum, don't forget the potential for vaccinating cows to prevent some of the conditions of the very young calves, particularly neonatal diarrhea or scours. Just say a little bit about abortion. Infectious abortion is common in the Northern Ireland dairy and beef herds, and there are many and varied causes for it. But some of the most important ones, and Helen has already talked about BVD, and also leptospirosis and IBR, and also Salmonella Dublin, can be prevented or largely controlled by vaccination of the herd against those diseases. And certainly in Northern Ireland, I just want to emphasise that over the last season, as we would have the last autumn winter calving season, we saw a lot of Salmonella Dublin problems, and I think that we do have quite a high level of salmonellosis due to Salmonella Dublin in the dairy and beef herds in Northern Ireland. There are vaccines available, and I find that if they are used, that they are effective. Other means of preventing abortion, very, very much as Helen has already talked about. She's talked about her health scheme, she's talked about her accredited herds, she's talked about biosecurity, she's talked about the testing of animals, particularly for BVD or IBR, before they come into the herd. If you don't have these infections that can cause abortion into the herd, then do not import them. So do have a plan excuse me, that incorporates an appropriate buying in policy and, very important, a quarantine and testing policy. You do need to submit material to the laboratory if you want to diagnose the cause of an infectious abortion. We will find an infectious cause of abortion in round about 55 to 60% of cases. Some of those other cases that we don't find the infectious cause, it may be there, but we haven't found it. There are relatively few of those. or it's due to what we call a metabolic abortion or a failure or placental failure. That is not uncommon in cattle. The reasons behind it are not always particularly well understood, but they are there. Nevertheless, do remember that submission of fetal material, particularly the placenta or the fetal stomach contents, the contents of the fetus's stomach, are very important diagnostically. And the better the samples we get, the more chance there is of a diagnosis. And finally, just a point to remember is that you are submitting partly to achieve a diagnosis. You're also submitting to rule things out. If we can come back and say, well, we haven't found an infectious cause of this, but we haven't found salmonella, or we haven't found neospora, or we haven't found a bacterial cause of abortion, or we haven't found BVD or whatever, then that is as good a information, sometimes better information, than actually knowing what is going on.